Hi everyone, how's it going today? We have some new details with Alexee Trevizo. Her attorney, Gary Mitchell, did talk about some of the things that we haven't heard of yet. We know some of the basics where he said that his client, Alexee Trevizo, didn't know that she was pregnant. And as you guys can see in my thumbnail, I mean, a lot of people have a hard time believing that she didn't know she was pregnant. For me, initially, when I saw pictures, I was like, oh, I think she looks chubby. I don't know. She's like a really small frame person. It looks like she could be really chubby. But then, I think I kind of retracted back because I've seen some videos where when you see her in motion and she's especially wearing like tighter clothes, like her cheerleading clothes, it really does look like she's pregnant. Like she does have a small frame. She's like, I think 5 foot. And it kind of just looks like she's got a basketball under her shirt. So a lot of us are like, she didn't know? Really? Are you sure? And then also, she was taking weight loss medication per one of the interviews of the hospital staff, because she asked the hospital staff, what would happen if you stopped taking birth controls and started taking weight loss pills? And the hospital staff told the police that, it kind of makes sense why she asked that, because if you knew you're pregnant, you're obviously going to stop taking birth control pills and you're going to take weight loss pills to maybe hide the fact that you're gaining weight because you don't want people around you to know, specifically in her situation. But I recently did a YouTube video about it, just like a little recap, because it has been about more than a year and a half since Alexee Trevizo gave birth, and then her child was found in the hospital bathroom trash bin. And so I did a little update just to kind of like refresh our memories about some of the interviews and what the hospital staff said, and then what she said, her defense and all that stuff. The judge has ruled that there are some evidence that the state wants in their case that's going to be excluded. And it seems to be, things revolving maybe around like the body cams of the police, maybe some security footage, and then possibly a good chunk of what the hospital staff said in their police interviews. So that could be very problematic for the state when they're presenting their case. So since the trial judge made her ruling, the state has now taken it to appellate court to see if they can overturn that. So we'll see. I think it's a huge chunk of evidence that's it could really hurt the state's case. But at the same time, at the end of the day, it's like, woman gives birth in bathroom, baby found in the hospital trash bin, and the baby is deceased. And then we have to go by which autopsy report, right, that we want to go with. So, of course, the state has their autopsy report that says that the baby died of entrapment. And essentially, when the baby was born, the state is saying that, she put the baby in the trash bin. And then because the way she wrapped the plastic bag, the baby probably didn't have enough oxygen to, sustain life and breathe. And that's how the baby died. Now, Alexee Trevizo's attorney, they're saying that oh, no, when she gave birth, like the baby was already dead. It was a stillborn. And, Alexee must have panicked and then just put the baby in the trash. But there's a lot of stuff that I want to go over about that, because I don't know. There just seems to be a lot of holes in what he's saying that just doesn't really make sense to me. It really seems like this was a person who knew that she was probably pregnant, and that when she went to the bathroom, she had all purposes, all intentions to conceal that she was pregnant. She denied that she had sex. She denied everything to her mom. She said she wasn't pregnant and stuff like that. And when she went to the bathroom and, she for sure knew that she was pregnant, because obviously a baby came out. It seems like she stuck to her plan and did whatever it took to conceal the baby from her mom. So I don't know, lots of issues, but I want to go over what her attorney said, and I want to see what you guys think, because I was actually going to make a video about this, and I was like, nah, I want to do a live stream because I want to hang out with you guys, and then it's kind of cool to talk with you guys about all that. Will they be able to include the hospital video as evidence? So because the case is pretty much sealed, we don't really know what they're excluding. I know the state was arguing that the footage of her going to the bathroom, they said there was like a public area, public bathroom, even though it's in a hospital, but the public does have access to it. They wanted to argue to have that video included, but I think the defense was okay with that. What the defense especially didn't want to be included was everything that happened from when Alexee Trevizo arrived at the hospital, everything that she told to the hospital staff, the doctors, and then her going to the bathroom. I think he was okay with that footage. It was everything that happened afterwards as well, what she told the hospital staff, and then the police showing up with the body cam footage. He said that violates HIPAA. But then I think the argument that he was really centering on was that, hey, the moment that she got into the hospital, anything that she said to the hospital staff, that's like, that's like patient privilege. So it seems like the judge sided with that, and yeah, that could be tough on the state. You're putting me on my, oh my god, on the TV. Wait, on the TV, can you see my lip? I busted my lip, man. Oh my gosh, I was when we were traveling, I forgot to bring my Aquaphor. Way to make your chapped lips nice and juicy. Not an ad, by the way.
First, maybe just a quick update on Alexee. Where is she? What is she doing? Is she out on bond?
Oh, because Alexee, she is supposed to be attending first year of, well, actually, oh man, I can't believe time goes by so fast. She was attending first year of college. I think they said she was doing it remotely. The judge allowed her to attend classes. There was a petition, though, that wanted her to get kicked out of the university.
She is out on bond, and she is attended via Zoom and such. She's got 1 year of college behind her during this time that we've been.
I don't know what's up with Gary Mitchell's internet. I don't know. It'd be a little bit hiccupy.
And okay,
but she's at home.
So she's at home with her family and doing school remotely. Let's talk about what happened in that.
I wonder what's her relationship like with the father of the baby, because I think I heard that he also attends the same university as well. I wonder if they're like on speaking terms. Maybe they're still together. Maybe they don't talk to each other anymore.
That bathroom. What, from your perspective, your investigation, what happened behind that locked door for 18 minutes?
She gave birth, as best we can tell, and as the evidence indicates, it was a birth that came immediately. She hadn't even had the opportunity to sit on the commode when she started giving birth. The child, the fetus, and the placenta were born almost, not simultaneously, obviously, but within short order of one another. She was in absolute shock, didn't know what was happening. The child was born into the commode. She rescued the child from the commode.
Now, that's a very interesting phrase that he used there. She rescued the child from the commode. Now, if people are already in the mindset that, you know, the baby was born, it was breathing, and that the reason why the baby is no longer living is because she put the baby in the trash can, the, you know, baby wasn't able to breathe anymore. I don't know, just very interesting choice of word that he says rescue right there. Because, I mean, obviously he's her defense attorney, right? He's going to try to advocate for her in every way that she can. But I feel like he methodically used that word. She rescued the child from the commode.
Placed absolute shock, didn't know what was happening. The child was born into the commode. She rescued the child from the commode, placed the child in a sink. The child never moved. The child never opened its eyes. The child never cried. And she has taken a polygraph test and passed it.
So this is what I picked up on when I was looking up the case last year. I saw that there was a polygraph test that was done, and I was like, they did a polygraph test? Do we really care about the polygraph test? When was this? This is back in... So this is the polygraph that he's talking about. Back in August 30th. Notice a polygraph examination and certificate of service. It's like, do we really care about the polygraph? But okay.
That in fact happened. Later, she tries to clean up after herself, places the child in the disposal.
Now, notice that Gary Mitchell, he is struggling to say this part right here. He's like, she places the child in the guard. No, I don't want to use that word. And then he says, because there's really no good way to word that, to phrase that, what his client did to the child afterwards.
In the disposal, that's the trash can, and thinking the child had never been alive. And that is still her belief to this day.
So just a recap of that, he says that she gave birth. Evidence indicates that it was a birth that came immediately. Okay, we don't really dispute that. She didn't even have a chance to sit on the commode, I guess the toilet thing, when she started giving birth. The child and the fetus, the placenta, was born almost simultaneously within, I think within like a short amount of time with one another, and that she was in complete shock. Didn't know what was happening. Child was born in the commode. She rescued the child from the commode, places the child into the sink, and from that determination, she's like, well, I'm in a hospital. There are staff members here who could potentially do life-saving measures, but no, because I'm a 19-year-old teenager and I'm probably smarter than the hospital staff, I'm going to take the baby and then just place it into the trash bag and discard it and hide it, and then come out of the bathroom and act like nothing happened. And it's just so crazy to me that she didn't even give a chance for the hospital staff. Let's say it went the way that she said it did, right? And the baby was born and it wasn't breathing, wasn't crying or anything. No eyes were open or anything like that. I mean, you're a 19-year-old. You don't have any hospital, you don't have any like medical experience. You didn't even give the chance to the people who have that experience to even try to save the baby. I don't know. That part is really crazy. Like when this goes to trial, that has to be going through the jury's mind.
Dr. Carol Liberman.
What was there? Child never moved. Child never opened his eyes. The child never cried. Said that she took a polygraph and she passed it. There was a comment below here that I thought was, if a woman doesn't know she's pregnant and goes into labor, she's going to be freaking out, terrified, yelling for anyone to come help her. The fact that she gave birth in silence tells me she knew and had no plans to tell anyone. Consciousness of guilt. Because remember, after she gave birth, one of the hospital staff was like, oh, she came back and they confronted her with a positive pregnancy test. And even at that point, she still denied that she was pregnant. She denied having sex. She said she was a virgin. She was still lying up until that point. And by that point, she had already secretly given birth in the bathroom and was confronted with a positive pregnancy test by the hospital staff. And she was still kind of, standing her ground about that and lying to her mom and lying to everyone around her.
Thinking the child had never been alive. And that is still her belief to this day.
Dr. Carol Liberman.
And then
go ahead, Gary. You can finish. I thought you were done.
And she leaves the bathroom and goes down to the room where she was at. And all of that, so her going to the bathroom and leaving the bathroom are all on video.
And then remember, there's a picture of the bathroom where you can see there's like a cord that you can pull that will chime or ring or whatever you want to say it. And then it will alert the hospital staff that like, oh, someone's in the bathroom and they need assistance. They need help. There's a cord right there that she could have pulled. But let's say she didn't see the cord. Let's say she didn't, see the cord that was next to her right by the bathroom that she could have pulled. That's probably like, I don't know, is it like a bright red string or something like that? Let's say that she didn't see it, right? I mean, the fact that she didn't yell, shout, say anything. We have a footage of one of the nurses right here. At some point, even though she was left, I think like for about like 10 minutes, she was like kind of like left alone. At some point he did come over here and he was kind of like waiting over here. He waited across here, went back and forth. They were like knocking on the door, checking up on her to make sure everything was okay. And she never said anything to any one of them. And I think what strikes us as really eerie is that when she gets out of the bathroom, I mean, you could say she's in shock, but it's like as if nothing happened. She just casually walks out of the bathroom. She finishes wiping her hands with a towel, tosses it away, and then just continues walking. That to me is really fucking eerie.
All on video. We're watching it right now. Dr. Carol Liberman, put us into the mind of a teenage girl.
Because that's what, like when we see that, it's like, she must have had all intentions to wanting to conceal the baby no matter what and hide it from her mom. It's just so crazy. I don't know if I'm going to listen to her segment. Let me see what my notes are. I think she goes off a little bit, but then Vinny pulls her back in. I will go to some portion. I think she said that like, all the friends and stuff knew that she was pregnant. People on Facebook knew, people were gossiping, and then her attorney responds to that. I'm going to go to the attorney's response.
Because you made that point at the beginning. And she could have she told her friends she went to as a cheerleader with her big belly. I mean, clearly that she was lying to everybody. Well, I mean, except the people she told, but she was lying to everybody else. And she had a boyfriend. I don't know whether she told him or not, but she was.
Yeah, I know defense attorneys are very interesting to me because of like the different ways they approach things and like the different theories they provide for their clients. I mean, it's their job, right? But I always find them very, very fascinating and sometimes really silly. Because sometimes, you know, when they throw out a theory out there, you're just like, what the fuck did they just say? Did they just really say that? Did they really just try to trick the jury into believing that? Like, I don't know. It's very interesting.
Was going out with him still up until this time and after this time. So this is not how it had to be. I mean, I think she's definitely responsible.
Gary, I wanted to give you a moment if you wanted to respond to anything.
Go on, Gary.
Well, sure. I don't know where information because it hasn't been disclosed by the state. It certainly hasn't come up in our investigation. And in fact, we've interviewed all of the.
Oh my God, Gary's got the worst internet connection over there. Gary, stop stealing Starbucks internet. Stop stealing their Wi-Fi. So what will be interesting to see in the trial is if the state gets a hold of any of her friends, text messages, Instagram, Facebook, whatever it is, any messages that shows that she may have told someone that like, hey, I think I'm pregnant. Hey, you know, I'm pregnant. What should I do? Oh, I'm scared. Or like communication between her and her boyfriend. They'll have to get other people to come and testify and be like, oh yeah, Alexee told me that she was pregnant. Or maybe, you know, maybe no one really didn't know. Maybe no one maybe, what am I trying to say? Maybe there wasn't anyone that did know that she was pregnant. Although I'm sure, you know, if you're looking at the videos that we've seen before, they had to be like, something's up with Alexee Trevizo. I mean, like teenagers are teenagers, but they're not dumb.
She did not know. And I don't know whether this is coming through the internet or some kind of gossip or Facebook or something, but that is not any of the evidence the state has produced or that I produced in this case.
I forgot she kept flushing over and over. Yeah, so I think people were saying that like, oh, was she flushing like the placenta down the toilet? Or it's possible that she was wiping up all the, the blood and maybe flushing that down as well.
There's no such witnesses.
Right. That was a crazy one to me, too. The male nurse that testified, I think the triage nurse, he was the one that said that, you know, I asked her what, you know, he went to the bathroom and he was like, he asked her what happened. And she's like, nothing, I'm on my period. And it was like, oh, OK. Yeah, that's crazy. Gossip
or Facebook or something. But that is not any of the evidence the state has produced or that I produced in this case. There's no such witnesses that she knew. And in fact, she did not know. And I don't know whether this is coming through the internet or some kind of gossip or Facebook or something, but that is not any of the evidence the state has produced or that I produced in this case. There's no such witnesses that she knew. And in fact, our belief is she didn't know at the time. And the hospital knew. They knew almost 50 minutes before she went to the bathroom.
Right. So now, again, we're going back to shifting the blame on the hospital. That is what the defense is going with. They're really saying it's the hospital's fault. Okay. It's the hospital fault because they knew that she was pregnant. They gave her morphine. They gave her all this medication that could have contributed to the death of the baby. And then also the hospital knew she was pregnant, but didn't tell her before she went to the bathroom. No wonder she was so scared when she was in the bathroom and all of a sudden the baby came out of her. You know, like, I don't know. That argument just seems really like, if I was a member of the jury, I'd be like, I think giving a lot of side eye to Gary Mitchell over there. That's a lot of side eye. And it's really hard to want to believe Alexee Trevizo, the fact that she said that she didn't know she was pregnant, because, you know, from all the hospital staff members, they've all said that she's been nothing but duplicitous, right? She came in, she lied about almost everything, right? They said that she lied about having sex, about being a virgin, about not being pregnant. I mean, she said that she was still on her period and on her period. Maybe, I don't know, maybe she really didn't know, but it's just really hard because there are some key things that she has denied that are straight up lies. Even when confronted with a positive pregnancy test, because I think they gave her a positive pregnancy. I think her urine came back positive, and then they did a blood test which showed that like, oh, okay, like you're pregnant, ma'am, and she was like, no, I'm not pregnant at all. She's probably like, I don't know what you guys are talking about. I don't know. Is there something wrong with the test? I don't know. But yeah, now we're shifting the blame to the hospital.
The hospital knew. They knew almost 50 minutes before she went to the bathroom that she was pregnant, but they didn't tell her. And that's an admission made in court, and the court has found, as a matter of fact and law, that they did not make her aware that she was pregnant, and they did not tell her. So we've already.
So again, there's the bathroom right there. There's this long cord right here. I'm assuming that's the emergency pull. Like, hey, if you need assistance, pull this fucking thing right here. But it's possible that she didn't see it, like I said. But I mean, you could still shout, scream, help, help. Oh my God, I'm pregnant. There's a baby coming out of me.
Already had that hearing.
All right, Gary Mitchell staying with us. Dr. Carol Liberman is going to stand by. What hospital and how this could happen in a hospital. And did they follow proper protocol? I want to walk through a timeline of what happened so you have a better idea of what's happening at what time and in what order. We begin. This is January 26th and 27th of 2023. Alexee first attends school and a 3-hour cheerleading practice, right? So it's a pretty normal day for her. 11:47 p.m., Alexee is taken to the emergency department and complaining of back pain, ranking it a 10 out of 10. So she's in a lot of pain.
I actually want to see the text messages between her and her boyfriend, because I wonder if those text messages, if there's any indication that he knows that maybe she's pregnant, or because I was wondering if maybe she tried to ask the boyfriend to take her to the emergency room, and he's probably like, oh, I can't, like, it's late, I can't leave. You know, my mom's gonna be like, why are you leaving? And then that's why she ended up resorting to asking her mom to take her.
Alexee Trevizo's attorney, Gary Mitchell, still with us, and now joining us, former emergency room doctor. I want to show you, though, doctor, the toxicology report and get your reaction to that and everything else that we went through that happened that night. Kath?
Okay, so toxicology report. Okay, so this is oh God, I'm sorry. This is really hazy. I'm gonna do my best to read it to you guys. I wouldn't recommend you guys looking at the screen to read this, but this is the autopsy report that was done on the baby. I'm just gonna read it again. I think I've read it before in a different video. Narrative, summary, and opinion. Baby John Doe was redacted. Baby boy who died. All this redaction. Something about cleaning staff redacted. Were cleaning up the blood in the restroom when they removed the trash bag from the trash can. They found the baby in a second trash bag under the first at the bottom of the trash can with bloody paper towels. The trash bag he was found in was tied closed when it was found. Redacted was notified of the found baby. Redacted, death was pronounced. No resuscitation was attempted. When questioned about the incident, the mother reported the baby was not crying or breathing. Redacted. So she put it in the trash bag. Yeah, that's just common sense. Yeah. Especially when you're at a hospital. Redacted. It is thought that a placenta may have been flushed down the toilet. Autopsy and postmortem computed tomography, so CT, showed an infant male without any anatomic abnormalities or obvious physical injuries. The lungs were aerated and there was air in the stomach. So that right there could be very important into believing whether or not the jury is going to find if the baby was alive when she gave birth. And no changes of decomposition. The connection in the heart, foramen ovale, and the ductus arteriosus that allow proper blood flow in the utero were still open, which is not unusual. Redacted. The adrenal gland showed microscopic hemorrhage, which can be seen in hypoxia, lack of air. Postmortem viral testing showed no viruses. Postmortem bacterial cultures showed no growth in the heart, blood, or left lung. I could have sworn Gary Mitchell was like, the baby was, I think they found that the baby had like influenza A, B, the baby had like COVID, the baby had like all types of stuff. There was like E. coli and all that. I want to see, I don't know if the defense ever provided their autopsy report, because I want to see that. It's so sad to hear about a baby being thrown away like a used tissue. Yeah. I mean, even if the baby was found, like, even if you gave birth and the baby wasn't living, it's like you don't even want to give your baby a proper burial or anything like that. Like, no. I don't know. She was just that scared of mom, I guess. Where was I? Oh, sorry. Okay, so postmortem, blah, 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 blah. The right lung and cerebrospinal fluid showed rare growth of likely contaminated bacteria, given the lack of inflammation in the lungs and brain. Postmortem vitreous electrolyte shows no abnormalities. A metabolic screen was negative for underlying metabolic disorders. A chromosome analysis was attempted, but was inadequate for interpretation. Postmortem toxicology showed phentermine, a derivative of an amphetamine. Sorry, this is the part that I wanted to read. That is often used as an appetite suppressant, and morphine, an opiate narcotic analgesic. So let's go back to the phentermine. So remember, one of the nursing staff said that Alexee Trevizo asked, hey, what would happen if I stop taking birth controls and start taking weight loss pills? And the phentermine, well, it seems like she was on weight loss pills, but these pills are prescribed to her. So yes, she is like, she's an adult. But like, I wonder, how was she, like, she must have been with someone, maybe like someone that gave her a ride, or maybe she does drive. Maybe she didn't need to go with anyone to get these prescriptions for weight loss medication. Or maybe she didn't get it from like a prescribing doctor. Maybe she got it from a friend. Maybe she bought it off somewhere on the street. But that to me seems to be like a resourceful person, to, as a teenager, to be able to get this prescription medicine. But maybe she, like I said, got it under the table. Is phentermine a good choice for weight loss? This is on Mayo Clinic. Phentermine is a prescription medication used to lessen appetite. It can help weight loss by making you less hungry, or it can help you feel full longer. Phentermine is also often combined with topiramate for weight loss. The combined drug is approved for long-time use. Phentermine is approved for use up to 12 weeks, but weight management can take time. So some healthcare providers might order it for longer use. Like other weight loss medication ordered by providers, phentermine is meant to only be a part of a weight loss plan. For example, it can only be used with healthy eating, physical activity, and behavior change. Phentermine is for people with obesity or overweight who hasn't been able to lose enough weight with diet and exercise alone to improve their health. Phentermine is a Scheduled IV drug. This is a label given to drugs that can be misused, but the rate of misuse seems to be low. Common side effects, I'll skip that. Phentermine is one of the most prescribed weight loss medication, but it isn't a good choice for people with heart disease, high blood pressure, or overactive thyroid gland or glaucoma. This is the part that I wanted to read. It also isn't for people who are pregnant, maybe pregnant, and or are breastfeeding. So I wonder if there's a way are they able to determine if Alexee Trevizo truly discontinued her birth controls? Because I'm assuming she was taking birth control pills, right? So is there a way for them to determine, okay, like, let's say, we have the toxicology of the baby. Would it be able to show whether or not birth controls would have been in there if they did like another toxicology report? I don't know. I have no idea. Because it could mean a lot that if she was taking birth controls and she stopped taking it and she started taking weight loss, then that would kind of like give us a sense of what was in her mind, right? Which is, oh, fuck, I'm pregnant. Well, I don't need to take birth controls anymore. Now I'm going to take weight loss to hopefully lose weight. But the weight loss medication could also go into her argument saying like, oh, I just gained a lot of weight. I didn't know what was happening and I just wanted to lose weight. I don't know. Right. But for us, if the state can figure out a way to show whether or not she was taking birth controls and then stop taking it and then start taking the weight loss medication, I think that could really help us get into her mind during this time, during the 9 months that she was pregnant. She should also be charged with taking these meds while pregnant. How will the case change if they can prove she didn't know she was pregnant? I don't know. I mean, honestly, if she didn't know that she was pregnant, to me, I feel like it doesn't matter because at the end of the day, the baby still came out of you. I think what's really going to come down to is whether or not the baby was born alive when she gave birth. I think it's going to really come down to that. And of course, that's going to be, the battle of the experts, right? The state's going to say, they're like, oh, the baby was born and the lungs were aerated. The stomach was aerated. The baby was born alive. And it seems like the baby wasn't able to get any air. The defense, they're going to argue, they're like, oh no, the baby was actually born a stillborn. So that's going to be like, I think like the most important part. But I mean, it would help to know whether or not she knew she was pregnant or not. But I mean, I think the fact that like the baby was found in the trash bin, I mean, that already speaks volumes, right? Like that's already crazy. She said to the doctor at the hospital, is it okay to stop taking birth controls and take diet pills? Yeah, for the autopsy, the baby was alive. Yeah, the state did the autopsy and they said the baby was alive. Now, of course, the defense, they're going to hire their own expert and they're going to try to rebut that. I think the baby being placed in the trash can underneath the liner tells us a lot. And the fact that she tried to clean it up, the fact that she still denied being pregnant after, the pregnancy test was presented to her. And yeah, all of that. It just really shows that, when she went into that bathroom, the intention was to hide the baby no matter what. And it's just really sad that someone who's 19 years old would have that sort of like silly, childish mindset. Like if Alexee Trevizo was, I don't know, like young, like super, super young, like 7, I don't know, like 12 or something like that. And they were super scared. They didn't know what they were doing, but she was like 19 years old. Okay. She was 19 years old. So crazy. Isn't that why Richardson girl got off? Is because they couldn't prove the baby was alive. I think initially they thought the baby was alive. Oh God, I had to dig my brain about that. But yeah, I think the jury believe the defense's expert when they said the baby was not alive. I'm trying to think because there's something about the state thought the baby was alive because there was smoke in the lungs, right? But I think the smoke in the lungs ended up being because Richardson tried to burn her baby. I don't know if I remember that correctly, but I feel like that might have been something like that. But if anyone knows the case way better, I just forgot the details. But yeah, Richardson did end up getting off because they believed that when she did give birth, the baby was not alive. But anyways, yeah, so, maybe, I know the defense is saying that like, oh, you shouldn't be giving a morphine to a pregnant woman. Well, this pregnant person, she was giving herself this weight loss medication that's not meant for people who are pregnant. But again, that goes back to his defense. He's going to say that like, oh, well, she didn't know she was pregnant, so that's why she was taking it. So, oh, yeah. Okay, sorry. Let's go back to this. So again, they found caffeine, morphine, and phentermine.
Caffeine presumed positive.
Do we know if the DNA has been? Yeah, see, that's what I was interested in too, because I was like, okay, like I could only imagine this irrational fear of her mom finding out that she's pregnant if she was impregnated by someone that wasn't her boyfriend. Like let's say it was like if it was a result of like incest or something like that, or if it was like some sort of like abuse happening, and she didn't want her mom to know, or she was too scared to say anything because she didn't want to, she didn't want to have like maybe like the perpetrator go after her. Like that's what I was thinking. Like, okay, like I could only imagine this really happening if she was like really scared of, maybe she was like, maybe the pregnancy was something that she didn't want to happen. Maybe she didn't want the sex to happen or something like that. But I don't know. That was me just being, because there's been nothing that points to that. Her defense attorney hasn't mentioned that. So that was something I entertained in the back of my head. But I mean, it's not something I'm going to speak out loud about anymore because, her defense attorney is there to defend her. But initially when I heard about this, I was thinking like, oh, maybe there's some like really weird fucky shit happening in the background where she's like a victim of something else. And she was just really scared of having her mom find out. Or she was scared of, like them coming after her or something like that. So yeah, I don't know, but her defense attorney didn't say that. So I think it's like similar to like the Karen Reed trial where I was trying so hard to get what the state was trying to show, and I felt like I was doing like jumping jacks and like fucking gymnastics just to get their theory to like fit in a way that we can understand it. And I was like, fuck this, I'm not gonna do that anymore. It's the state's job to explain it to us, okay? We don't need to be doing all this shit in our minds. Her mom is paying for the attorney. I think he's a public defender. So I'm sure she's paying for like some court fees and all that stuff. But I mean, I think he's a free public defender. I think if it says on her case as well. I thought he was a public defender. Wait, is he not? Am I getting confused with a different case? Oh, Gary Mitchell Law. He's got a website. Gary Mitchell Law. Come see us for your best defense. Oh, wait, is this his website? Oh, is this him? Take a look at his website. I don't know if that looked like him. That doesn't look like him. I don't know if that looks like him. Gary, is that you? I can't tell actually. I cannot tell. Maybe he's not a public defender. Sorry, maybe I'm wrong. Gary C. Mitchell, though. I think that is his name. All right. Okay. Well, I could be completely wrong.
Morphine free, 19 nanograms per milliliter. Phentermine, 420 nanograms per milliliter. What are your thoughts about the toxicology? And what are your thoughts about the way this patient was handled and treated that night into the early morning hours?
Well, it's very interesting and obviously fairly complex case. And obviously I don't have the ability to look at the charts and all aspects of how care was done. But first of all, in regard to the toxicology, I think that the treatment at times of patients with back pain, even patients that are pregnant and we know are pregnant, giving small amounts of morphine, well controlled in the sort when you're pregnant, even in pregnancy, and in delivery is often done. Obviously, there's epidural blocks and spinal blocks, and even nitrous is used often to relieve pain during birth. So it's not unusual to give small amounts, to give controlled amounts. I can't speak specifically to that toxicology review, but obviously there's a drug there also that's an amphetamine type drug that's for weight loss. which is kind of interesting. Depending how long that was taken, that can have effects on neonates and their development and the sort, depending on the timing of that. And also, of course, morphine, if given over a long period of time, can be cause a neonatal abstinence syndrome, where you could have to have withdrawal and the sort. If you've been given morphine, you see patients that are addicted.
He made the website in paint. The website is charming, but I prefer the website of what was his name again? One of Karen's attorney has like a really good website where he'll show you all the cases he's worked on and whether or not he won and stuff. I really like that.
That deliver with that type of situation at times. A few other kind of interesting things, just in regard to the protocol as I understood it. It's when someone comes in with back pain who is of a woman of childbearing age, we by protocol get a pregnancy test. That's a normal case, and that's usually done that if you're trying to examine, for example, the back, assuming that you've been told that one is not pregnant and you don't see signs necessarily of pregnancy that are obvious. You've examined the back. You do this really because you are trying to first assure, before you do any radiographic imaging, for example, CTs or the back and the sort, that isn't in fact the case.
So let me ask you this, doctor. If there's notice of a positive pregnancy test by 12:51 a.m. that's showing up somewhere, and at 1:39 a.m., this teenager gets up, is let out of a room, and goes down to the bathroom by herself. Is that sort of an unusual lapse of time between that information and allowing the patient to go down to the bathroom? Because I suspect the people who let her down there didn't know that she was pregnant, or maybe they did.
Well, that's the issue. So, the laboratory testing, if in certain emergency departments you have really quick point of service testing, you can get that test very quickly. If it's done through the regular laboratory, it wouldn't be unusual for that to come back with any other labs over a period, let's say as long as a half hour. So the delay in getting that, it would not be unusual to have that delay. It would not be unusual if someone was in terrible pain to give even small amounts of morphine just to try to make for some relief. That wouldn't be out of the ordinary in that regard. There's certain.
I mean, it's possible that she could be one of the, small stats of like people where morphine did fuck up her pregnancy and it resulted in that. But I mean, it would be hard for the jury to overcome infant found in plastic bag that was twisted and tucked underneath.
The issue of how she's on morphine and unaccompanied goes to the bathroom, for example, after being given certain amounts of depressive drugs, that's something that might be of interest to be looked at in that regard.
Gary Mitchell, from your perspective, where do you think the hospital dropped the ball here?
Well, they dropped the ball from the moment she walked in, because it indicates such. And I'm not just a lawyer. I happen to be a chairman of a hospital and have been in that
Wait, he's a chairman of a hospital?
world for 40 years. You assume that if you have a woman of childbearing age in the hospital and she's complaining of low back pain, you make certain she's not pregnant. I mean, it's a simple test. It came back quickly. It came back on the computers. Every nurse that was taking care of her and the doctor all knew at 12:51 that she was pregnant. They did not tell her. And then at 1:39.
See, that's a really hard thing to convince the jury. So let's say we even agree with what Gary Mitchell says, that his client believed that she wasn't pregnant. She didn't know that she was pregnant. Absolutely didn't know she was pregnant. And then found out the moment she went to the bathroom and the baby came out of her. At that point, she knew she was pregnant, right? It would be really hard to overcome the fact that, so like aside from the trash bin thing, the fact that she came out of the toilet, act like nothing happened, it's really hard to overcome if she really told the hospital staff after giving birth, after the delivery and everything, when confronted, they're like, hey, your blood test shows that you're pregnant. And she's like, no, I'm not pregnant. What are you talking about? I'm not pregnant. I've never had sex before. I'm still a virgin. I'm on my period. What are you talking about? Like, that's really hard to overcome for a jury. And I feel like for a jury to believe that, like, I don't know. If I was on the jury, I would feel like, oh, you're like trying to insult our intelligence. Like at this point, you're just making us like waste our time thinking about this. Like, I don't know, man. That's a lot of stuff you have to overcome.
They unhook her from the IVs and allow her to go not to a bathroom in her room. They didn't have them in her room.
Down the hallway.
They had her go down the hallway to a public bathroom in the emergency.
Was there a bathroom in her room? I mean, honestly, maybe she didn't want to go to the bathroom in her room because her mom was right there. Maybe she wanted to go to the one in the hallways. I don't know. I don't know if there's a bathroom in the room or not. I don't think so. I don't know if there's a bathroom in her room, but I don't know if there was a closer bathroom. Maybe she didn't even know there's a closer bathroom.
Gary, we're out of time for tonight, unfortunately. Gary Mitchell, thank you so much. Dr. Angel Iskovich, we appreciate your expertise. We'll be back.
Be smart later.
Yeah, I don't know, man. That's a tough one for Gary Mitchell. That's a super tough one. But I will say he did get his wins in the courtroom. We'll see what happens if the state, like I said, they appeal to a higher court. And let's see if the appeal court will overturn the trial judge's decision. Oh, man. I don't know. I feel like he hasn't really done much to convince us. You know, like, even if she didn't know for real that she was pregnant, like, there's just too much against her. But if you're on the jury and you don't have the statements of the hospital staff, I don't know, maybe that could be problematic. Maybe that could be tough for them.
We've got some video of Alexee Trevizo cheerleading shortly before her birth, and it was posted to TikTok by Evan the Plug. Let's take a look at this, because when you watch it,
I mean,
you say, oh, my goodness, it does seem, but it might be, is this 2020 we're looking at it in, that it looks obvious, I think you know which one she is in all of this.
Oh, well, I skipped through the, because Vinnie Politan does have other people on the panel that challenge what Gary Mitchell said. I just forwarded through them. I just want to hear from Gary Mitchell, because we're here to challenge what Gary Mitchell said.
Dr. Carol Liberman, let's talk about what.
Right? I don't know. Even without the hospital statements, I could never get past her own actions after giving birth. Exactly.
What's going on at school? You're walking around as a cheerleader like that, but she's still remaining very active. Like, if you knew you were pregnant or you thought you were pregnant, I don't know. I'm never going to be pregnant, I can tell you that. So what are your thoughts about her living? She's living sort of life pretty normally, going to school, cheerleading, doing competitions, 3 hours of practice before going to the hospital.
I don't know. I do wonder if she's ever gonna like testify or say like, oh, I don't know how I got pregnant. I have no idea. I've never really had sex before. I thought I was still a virgin. I don't know. I wonder if she's still gonna kind of say that, like go up on the stage, like, I don't know how I got pregnant. I don't know what happened.
Well, she was living in this sort of fantasy world that she wasn't pregnant. She knew she was, but in my opinion.
Doctors are dependent on patients to provide them with information, like mentioning if you have an allergy to some medication or if you're like pregnant. I think it would be it'd be very bad for her to testify. I think she would get destroyed at cross-examination. She's probably not going to testify. But, I feel like we need to hear from your side of the story, Alexee, because at this point, we're not really convinced. Maybe she can go up there and testify and then really convince us that she didn't know she was pregnant and she panicked and she was in shock and she's just a teenager who didn't know what she was doing and super scared of mom, place the blame on mom, maybe. Yeah, I don't know.
That when she was pregnant with Alexee, that her husband, or Alexee's father, presumably, beat her. So that could presumably, if Alexee knew that story, which she...
I'd be very interested to hear what her classmates say. I'm sure they've been interviewed by police by now.
Probably, had to, because the mother was connecting it to her spine problems and all that. That could have been a reason for why, or one of the reasons why she didn't want to be pregnant. She was afraid, that's a bad thing. Her father was beating her mother when the mother got pregnant.
I don't know, man. I think that's a stretch. That's a super stretch right there. Also, cute doggy. Hello, cute doggy in the background.
Oh, so I shouldn't get pregnant. Maybe my boyfriend will do that to me. Things like that. I mean, really, they should try to do to see if there's a psychiatric defense, to see what was really going through her mind.
Yeah, I think that was the other thing that I thought that the defense attorney was going to try to go with too. Maybe like some sort of get a psychiatric evaluation of some sort.
Okay, our guests are staying with us. When we come back, there was another case out of the same state of New Mexico.
All right, I think that was about it. They talk about Alexis Avila. She got like 18 months. Let's see if they say anything else afterwards.
August 26th, I believe, in Eddy County District Court here in Carlsbad. So The trial date is set right now. The defense has introduced motions to suppress a lot of the evidence gained from the hospital, arguing there was some some patient.
Oh, Dominique, I think this is the part that you're talking about.
Doctor confidentiality issues with the statements that she had made. And a district judge had actually ruled to suppress those statements, that they couldn't be admitted in the case. The Fifth Judicial District Attorney's Office has appealed that.
Man, it's just crazy to me that so much blame is placed on. Oh, sorry, do you guys not see that? My bad. So much blame is placed on the hospital staff, law enforcement. But if it wasn't for the hospital staff and law enforcement as well, I mean, the mom kept trying to like go after the daughter and get more information out of her. But the ER doc was like, no, stop. We're not going to do that. I mean, because we could have got way more information from the interaction between the mom and Alexee Trevizo, right? And then again, when the mom tried to get more information out of Alexee Trevizo, the police officer who was standing right there, he's like, oh, no, don't do that. Like, no. The detective will talk to her. Like, no. Like, basically stopping them from talking. Because, again, we could have got more information out of that.
Ruling to the New Mexico Supreme Court. We are waiting to hear what the ruling will
But
be.
I mean, it's good that they did that because obviously the ER doc wants to step in because she just wants to prioritize the care of Alexee Trevizo. And then for police law enforcement, they just want to make sure Alexee Trevizo's not saying anything that she's not supposed to without being Mirandized and all that stuff, I guess.
There, if that evidence will be brought back into the case before it goes to trial next month.
And that's the evidence we're looking at right now.
I don't think it's going to trial next month. They have a hearing coming up. I think it was a hearing August 22nd, motion hearing. But when was the trial scheduled? Was it September maybe? Yeah, I don't think that's going to happen.
Dr. Carol Liberman, comparing these two cases and these two young women.
There's no privilege since she made those statements with the third-party president. I think the judge disagreed with that, though. I think the judge disagreed with that, but we don't know the exact details of it. That's exactly what the state argued. State said that like, oh, well, her mom was there. So there's no privilege there. She was saying the statements and the mom was right there. But it seems like, from the judge's ruling, it seems like it was very damaging to the state's case. So, like I said, the whole thing has been pretty much sealed. I wish we could read the motions and all that stuff, but it's mostly sealed. We don't really have access to that except for what we hear from, defense attorney or the state. But yeah, that was the argument that the state did make about a year ago. The poor cleaning lady. Yeah, she was very traumatized about that.
It seems the issues may be similar, right? You're young, you don't know what to do, but it continues to happen over and over again. Why is that? And in this day and age, there's a lot of information out there, and there are laws that are set up where children can be dropped safely in places,
Yes.
and there's no penalty for it.
Yes, including in New Mexico, apparently. And her mother saying, I told you about this. I mean, you have to wonder if she even knew about this other case.
My kids, how can we expect doctors to magically diagnose things when patients purposely lie and knowingly lie to them? It's hard enough to make all the diagnoses when you have all information and the facts.
There are a lot of similarities in the sense that the
Well, we know about her openly telling her school friends that she was excited to have a baby and even had a name picked out. I heard about that, but I don't know if those are true or not. I did hear about that because one of the guests earlier, actually, she's the one who's speaking right now. Yeah, she said that Alexee Trevizo was excited. She was talking about, naming the baby Alex, blah, blah, blah. I don't know if it's true or not, though. But I did hear about that is a grapevine.
Miss Alexis, the one that you were just talking about, she... she brought her
Crazy how their names are so close to each other. Coinkadink.
baby to the dumpster, and that baby would have died. The judge said, but for the grace of God and luck, this would be a murder case. So now we have Alexee Trevizo, and she could have, her baby. The prosecutors have shown through presumably autopsy and pathologists and so on.
Oh, that's not her. In the second photo, that's Alexa Avila. Same thing. Teenager, gives birth, and then tosses baby in the trash can. However, in her case, her baby lived. But I think she still got 18 years.
on that the baby.
But this is also in New Mexico. So remember when her mom was freaking out? Sorry, remember when Alexee Trevizo's mom? God, their names are so like similar to each other. So there's Alexee Trevizo. That's who we're covering. The 19-year-old hospital trash bin. This is Alexis Avila. Gave birth, don't know where, I don't remember where she gave birth. And then there was a footage of her discarding her baby in the trash can, and then people found it and rescued the baby.
Baby did breathe. It was alive when it was born. And, perhaps if she would have run out of the bathroom and said, please help, perhaps they could have, before she did whatever she did to it, perhaps they could have saved the baby. So, this.
Yeah, it's just crazy to me how Alexee Trevizo has no hospital, no medical background, anything like that. And she determined, the baby can't live, and I guess no one can save the baby, so I'll just trash it. I don't know. It's so weird. I'd like to point out that the memorial of the house has the name Alex on it, so the baby was named Alex. Yes, I did see that. I just don't know if Alexee Trevizo had already chosen that name prior to giving birth and then told friends about that.
Hopefully, this is going to be influencing a lot of people, a lot of teenagers who find themselves in the same situation, which is why it's important that, I may have sounded heartless, but it's important that people get punished for doing